Hello ma'am, I am Shivangi Seni, a volunteer at GynacTalks, a campaign from Red Dot. And today we are warmly welcome Dr. Pragya Kalra, DNB, Obstetrics and Gynecology, a dedicated specialist from Dr. Kalra's Medical Center. We are very happy to have you, ma'am.
Good evening, Shivangi. I'm also the head of the Department of Gynae in GTB Hospital, Dehradun.
And with that, let's start our session.
Okay.
The first question is, why do periods vary in flow and color each month? And when should someone worry about clots or change in bleeding?
The periods vary in flow and color each month because of natural hormonal changes in the body, the hormonal influences that affect the uterine lining. So there can be mild changes every month, but a female needs to worry about her clots or the pattern in bleeding when there is a distinct change. Each female is aware of her own pattern of bleeding. So anything that is, if there is a big change, a significant change, not big, then she needs to worry about it and show to a doctor.
So, to add on that question, I was also like to ask, like, is clotting related to some kind of uh, problem in menstrual health?
So clotting, see, uh, le- medically clotting is a good thing. When there are clots, that means the bleeding is going to stop. But in periods, in terms of periods and in terms of menstruation, the layman feels clot means it's like passage of big clots. That is not normal. And there are many factors that can affect clotting, like as I told you, normal natural hormonal influences. Then there can be stress, diet, certain infections. So they change the clotting pattern.
Okay. So, with that, let's move on to the next question. How long should a normal period last, and what might it mean if it is shorter or longer in length?
Usually, a normal period can vary from 2 to 7 days. Each female has her own body. It can be in some females, 2 day cycle can be normal. In some, it can be up to 7 days. Any variation less than 2 days or more than 7 days is unusual. So when it happens, you should consult your doctor.
Yes. The third question, can headaches, breast tenderness, or back or leg pain considered as normal symptoms, or is it something else?
Yes, some females do have headache. I wouldn't say it's normal, but then it is a symptom in menstruation. Then mild breast tenderness, back and leg cramps are normal again in some females. The headache is due to estrogen in the body that causes headache in some females. Then breast tenderness is because of water retention. The breasts get heavy, and some females can have more of the breast tenderness. Back and leg pain is again due to prostaglandins that is secreted. So to some extent, yes, it is. No, it can be normal, but then you cannot, बस ये कह के कि it is normal. You cannot just ignore these symptoms. Okay.
Yes, so the next question, how much period pain is normal and when should one see a doctor?
Period pain can be considered normal when you can easily manage it at home with a simple painkiller and it doesn't hamper you from your daily activities. Any pain that interrupts your daily activities, like for a schoolgirl going to school, she's unable to go to school, a lady cannot go to office, cannot perform normal activities, then the pain is not normal and you should see your doctor.
And sometimes some females have these cramps and some do not. Is there a specific reason for it as well?
Again, some female, it's individual body, and then cramps. There can be some pathological reason also for the cramp. Some females can have some issues, some reasons why they are having the cramps, and some can have absolutely normal periods and no symptoms at all.
Okay, next question. Is it okay to exercise during periods or is rest better?
It's absolutely normal to exercise during periods. In fact, exercise करने से you have endorphins get secreted in the body. It makes you feel better. bloating कम होता है, it relieves you from cramps. But then again, we don't encourage very strenuous exercises because as it is, you're having cramps in your leg, you're having lower tummy pain, and if you start doing strenuous exercises, then it will add to the pain. So mild exercises which you have been regularly doing, you can absolutely do that, no problem in that.
So, as in yoga and meditation would do.
Yeah, yoga, meditation, normal mild exercises, normal gymming, normal running, normal jogging, normal swimming, whatever you have been doing, you can easily continue. There's absolutely no issue.
Okay. Next question. Can swimming or other physical activity during menstruation cause infections or health issues?
See, you have to be careful if you are planning to swim in pregnancies. You know, you cannot use normal menstrual pads while swimming. You have to use, you can use menstrual cup, you can use tampons, you can use period swimwear. So you are basically you have to be careful. Even if you're doing physical activities, you have to take proper care of hygiene. If everything is put into place, then infection shouldn't be a concern.
With that, let's go on to our seventh question. Do certain foods make cramps worse? And are there any foods that would actually help reduce the period discomfort and the cramps?
Any food that is having too much of salt, too much of sugar, too much of processed food, that can worse your cramps. Not per se, but see, if you eat such food, the bloating will increase. The bloating will again cause, uneasiness. The bloating can increase your pain, the cramps. And there are certain foods that can decrease. We say the foods that are rich in omega 3 fatty acids, like nuts. So you can take nuts as snack. Then some females are relieved by herbal tea, green tea. So these are the foods that relieve pain.
I think nowadays on social media, it's quite famous that we generally associate eating junk food will actually help us relieve pain. I don't think it's true
No,
myself.
no, it's not true at all. Basically, you eat junk food, it's a temporary happiness. Your brain is happy with all that stimulus which you get from the processed sugar. So it is very temporary relief. It doesn't alleviate symptoms as such, cramps. No, it's wrong. It's just a myth.
Okay.
Because junk food is loaded with, salt, sugar. Eventually, it will increase the bloating. So the cramp will come back.
Okay. So next question. What could cause someone to get their period twice in 1 month or experience spotting between periods?
Spotting between the periods, like mid cycle spotting, can be natural. It happens it happens in some females when you have ovulation. So you will have a little bit of spotting. So that is normal. But otherwise, getting periods twice a month or short cycles, again, the reason has to be evaluated. Then the female should go to a doctor, get the basic investigations like ultrasound, etc. And there are certain factors that cause these, get the period maybe twice or short cycles, maybe gain in weight if the female is exercising too much, or if there is some thyroid problem. Then again, in certain cases, stress, some hormonal changes, then medications. When you're taking certain medications, then you can have the cycle length may vary. You can have it twice a month. You can have shorter cycles, like antipsychotic drugs and some other drugs that are taken in mental illness. Again, then age is also one factor, breastfeeding is another factor. As you approach menopause, the length of the cycle can change. Okay?
So as you mentioned menopause, it's generally said that the starting and the ending of the period, the menstrual health of women, like sometimes it differs totally from the main time period of the menstrual health of that female.
Yes, whenever a girl has menarche starting of her periods, so the periods are anniversary in for few months in the initial years. And again, when you have menopause, when the periods are going to end, ovulation stops. Again, it's an ovulatory cycle. So whenever these are the two phases of life, when ovulatory cycles happen, and whenever ovulatory cycles will take place, it will get irregular. It can get shorter, it can get longer. But again, one cannot ignore it just assuming that it's normal. It's always better to consult to a doctor. Okay?
So next question: how do stress, travel, or weight changes affect the menstrual cycle?
Yeah, see, stress, travel, what happens during traveling? There's a change of place, right? So it is certain changes take place in the hormonal axis and they cause change of periods. Same with weight changes. Whenever there is excessive weight gain, PCOS is related to weight gain, then you can get PCOS, the cycles will become longer, the cycles will get delayed, and it can be other way around also. Too much of exercise, if you have a drastic weight loss, again the menstrual cycle will get disturbed. Then there is a condition, anorexia, where young girls, they don't eat, it's a psychological disorder. When you stop eating food, again the weight, there's quick loss of weight, and again the menstrual cycle gets disturbed. Okay.
Yes, ma'am. The 10th question is, how often should pads, tampons, or menstrual cups be changed, and are menstrual cups safer for long-term use?
Yeah, see, pads should be changed, pads or tampons should be changed 6 to 8 hourly. Especially, you have to be very careful with tampons, not to exceed 8 hours, because it can lead to toxic shock syndrome. When a female is using tampons, we say that if you're sleeping for 8 hours in the night, the early morning, whenever you get up, you should change your tampons. So again, it's 6 to 8 hours. And for menstrual cups, you can change it 12 hourly. That should be good. But when the people who use, girls who use menstrual cup, they have their own idea. You have to see how much the blood has collected and how frequently they should change it. Okay.
Okay.
Menstrual cups are safe for long term use, provided you are intelligent enough to know how to use and keep it. Uh, how to keep it properly and how to use it properly. It can be used for long term. There is absolutely no contraindication to it.
Okay. Next question. Do scented pads or intimate washes increase the risk of infection?
See, scented pads, I will say, is because how is the pad scented? Because there's addition of chemicals, right? So any kind of chemical will change the pH of your vagina. It should be avoided. It can increase the risk of infection. And intimate washes, again, a mild intimate wash is good, but then again, it should not be used too much. The best way is use normal water, normal lukewarm water, normal tap water. And if you're using a mild intimate wash, use it, once in 2 3 days. Frequent use of that can also lead to infection.
But sometimes, like the young girls who start their periods feel uncomfortable from not wearing a scented pad because there's a significant smell that comes, which makes them feel uncomfortable in public settings sometimes.
Well, what they can do is then the these days excellent quality pads come, right? And there is no smell as such in the pads. If they are getting smell in the pads, that means they need to change it frequently. Otherwise, why will they get a bad odor? You understand my point? And if suppose it's needed, if they're feeling socially conscious, yes, using scented pads once in a while is all right, but it should not be used regularly. Once in a while is all right, there's no harm in that. Okay.
Next question. Why do many people feel more emotional or irritable before their periods or during their periods? What happens in the body?
During periods, you know what happens? The level of estrogen, progesterone all increases, right? It causes water retention, it changes your mood. Then there are two important neurotransmitters, serotonin and dopamine. During periods, the level of these two goes down. So that makes you irritable, that makes you very emotional, that causes, weepiness. Many females, they weep during periods, before the periods. So because of these hormonal changes and chemical neurotransmitter changes in the body, all this happens.
Okay. Next question.
Sorry.
How can someone tell if their period changes are due to hormonal imbalance or something more serious?
See, a period change due to slight hormonal imbalance will be not too severe. You know your own body, right? You can yourself judge. आपका अगर periods 3 दिन होता था, maybe you can have it for 4 days, maybe you can have it for 5 days. But very heavy periods for 6 days, 7 days, then yourself know that something is wrong in the body. Something is, more serious. There is some pathology. So in that condition, you should go and visit your doctor.
Okay. With that, let's come on to a second last question. What's the best way to maintain good menstrual hygiene and prevent common infections?
See, the best way is education about menstrual hygiene. Okay, a young girl should be educated about pads, how frequently pads should be changed. If you're using tampons, how frequently tampons have to be changed. If you're swimming, what are the guidelines? How you should, use tampons, menstrual cups while swimming. Then, whenever you're using these devices, always wash your hand before and after. Okay. Then always wash your intimate parts whenever you're wearing a pad, before wearing it, before inserting a tampon, before inserting a menstrual cup. Wash your hands, wash your intimate area with a gentle wash, and always wipe it dry from front to backward. So that will help in maintaining the perineal hygiene. Okay. Then again, always try to wear cotton undergarments. Stay hydrated. One very important point is stay hydrated, drink lot of water, wear loose garments, cotton garments. And again, the disposal of these pads, disposal of tampons. Always wrap it in tissue paper. Try to dispose it in covered dustbins. Don't, litter it or throw it in open public spaces. So these are the things that will prevent infection in the female herself and also will prevent in spreading infection in the area close by. Yeah.
Now, this is the last question we have been asking to all the doctors we have done the sessions with. What would you suggest a young girl who has just started her period? It can be your opinion.
See, according to me, the most important thing these days, the age of menarche has gone down, right? We see girls as young as 9, 10 having periods. So, the most important thing is educate the girls. And I'm really glad gone are those times when period bird used to be a taboo in schools, taboo in public. Now, the girls are very smart. They are given good education about periods, and periods aane ke pehle hi they are very aware. They know what periods is, they know the science behind it. So the first thing is education. ठीक है? So she should be knowing what it is. Then second is she has to be reassured कि it is something that is normal. It happens to all the girls. It is part and parcel of growing up. And as you explain her about her periods, it's very important that you explain her about all the changes which is puberty in the body positivity होना बहुत जरूरी है and she shouldn't feel ashamed about periods. There has to be reassurance, there has to be empathy. Mentally prepare her for menstrual leaks in school. That's all right, that happens. She doesn't need to feel ashamed about it. And the best person who can teach her all this is of course the mother, right? Make the child confident that this is something that will happen. And small things like giving an extra pad to the kid, keeping an extra underwear in her bag in nice fold way ताकि वो confident feel करे. That is very important. And then another aspect is diet is very important. You have to teach these young girls that once period starts, you lose blood for 4 5 days, so they have to take lot of fruits. They have to take a high protein diet, to concentrate, take good diet, because that's the way their hemoglobin will be maintained. So that is the main message that I would like to give to young girls.
So, with that, all the questions are done, and the
Okay.
session was very insightful. Thank you for your help.
Thank you, Shivangi. Thank you for having me here. Thank you
Thank you
so
so
much.
much, ma'am.
Bye, Shivangi. Bye bye.